everybody, welcome to my talk today. It's part of a nursing career series and today it's specialist nurse and advanced nurse practitioner roles, and I have a video out on nurse educator roles, nurse researcher roles and more senior roles such as charge nurse and sister. So lots of helpful advice on my videos, and I'll be putting out some videos on how to prepare for interviews for those roles as well in the future. Do check out my YouTube channel, Support and Career Development for Nurses, where you can access the videos free and just hit the subscribe button. So during my 34 years as a registered nurse, and I worked as a lecturer practitioner for 28 years, I've interviewed lots of specialist nurses and advanced nurse practitioners over the years, and I offer career advice to people that aspire into those roles. And the questions I'm usually asked are, what do these nurses do and how do I become a specialist nurse or advanced nurse practitioner? So I hope to answer those questions today, and I hope you enjoy my talk. So when you look at specialist nurse roles and advanced nurse practitioner roles across the UK, it's evident that there are a range of job titles, roles and different pay scale sets across employers, and job descriptions may be slightly different across employers. And I've recently scoped this, and this is in June 2022. But in the future, there is a call for standardisation and regulation of advanced nurse practitioner and advanced clinical practitioner roles. So I will talk a little bit about that later. An interesting paper by Leary et al. In 2017 entitled Variation in Job Titles Within the Nursing Workforce mined data from pre-existing data sets of studies into the work of nurses working in specialisms. And data mining is a process of sorting through large amounts of data sets. It's used a lot in business to predict future trends and to inform decision making. And Leary et al. Found that there were 595 job titles in use in 17,960 specialist posts once the specialism had been removed. They also found that a total of 323 posts were recorded as holding titles such as advanced nurse practitioner or specialist nurse who were not registered with the Nursing and Midwifery Council. So this is why there is calls for this standardisation across our profession, in line with international working, I would say. So across internationally, most I would say countries, advanced nurse practitioner, advanced clinical practitioners hold a master's qualification, for example. Leary et al. Also have found the most commonly used titles were clinical nurse specialist, specialist nurse, advanced nurse practitioner and nurse practitioners. And that was, I've recently scoped a lot of job adverts, and these are the main titles that were being used. Also to note, some specialist nurse roles have standard proficiencies, whereas other specialist nurse roles are less clearly defined, where the future working in our profession is looking at advanced nurse roles being a defined level of practice, whereas with specialist nurse roles this is less defined. However, there are some specialist nurses, such as specialist community public health nurses, that have defined standards of proficiency and their own area of practice. And I'll talk a little bit about recordable qualifications with the NMC. And if you go onto the NMC website, under recordable qualifications, you will see an up-to-date list, as the list may change in the future. And as I said, there's this ongoing debate regarding standardisation and regulation of advanced nursing practice. So looking at calls for more standardisation and regulation for advanced nurse practitioner roles, watch this space. The NMC is currently exploring regulatory advanced practice following the publications of its standards of post-registration. So it's interesting to read the standards for post-registration, and they're aiming for potential approval of new standards for advanced practice by 2025. And it's notable that currently approaches to advanced practice across the 4 nations of the UK are at different stages. So we will see more cohesive working, I think, in the future. Currently, there is large-scale review and engagement, and consultations are taking place debating the issues around standardisation, and so do keep up with what's going on in the profession, and I'll obviously update videos in the future. We also have an RCN credentialing directory for advanced level nursing practice that is optional. You don't have to register with the RCN. However, some advanced nurse practitioners do accredit themselves through the RCN, and to do so you need to review the RCN credentialing for advanced level nursing practice handbook for applicants, and this again may be updated. This is being presented in June 2022. Currently, you must have NMC registration, non-medical prescribing rights, work at advanced level in clinical practice, and any nurse that wishes to work at advanced level of practice, this is a type of practice. It's not just a role or a job title specialising in one area of practice. Advanced level practice reflects the 4 pillars of advanced practice: clinical practice, leadership, education and research. And from January 2023, only full Masters Awards will be acceptable as part of RCN credentialing directory, and this is in line with international standards. As I said, it may change in the future, so keep up to date with the RCN handbooks and website. As I mentioned earlier, advanced level nursing practice competencies are country specific. So where I'm located, Health Education England has established a centre for advancing practice. So do check out, wherever you live in the UK, your government website, your NHS education website. And the Centre for Advancing Practice with Health Education England was established to oversee workforce transformation of advanced level practice by establishing and monitoring standards for education, training and accrediting advanced level programmes. And so we need to remember that advanced level practice and programmes are not just for nurses, they're for allied health professionals. There's also an e-portfolio route, and if you look on the website, it's got some really helpful information, and this route is designed to enable practitioners to evidence that they meet the advanced practitioner requirements described in the multi-professional framework for advanced clinical practice in England. Looking at standard proficiencies, it's helpful to review some additional frameworks and standard proficiencies for certain roles. And for example, there is the core capabilities framework for advanced clinical practice nurses working in general practice and primary care in England, and that's copyrighted by Health Education England, NHS England and Skills for Health. There are standards of proficiency for specialist community public health nurses if you're interested in these specialist roles. And you can register as a specialist community public health nurse to work in a more general public health role following the completion of required courses and proficiencies. But also there are some specialist community public health nurses that have their own area of practice, and that's currently shown on the NMC register, such as health visiting, school nurses, occupational health nurses and family nurses. And you must have undertaken a programme to prepare you for this, whichever particular area of practice is shown on the NMC register. So always check the NMC website for future changes and to see what qualifications are required and recorded if you're aspiring to these roles, and there may be ongoing changes in the future. We've also got specialist practitioner in general practice nursing, specialist practitioner in district nursing, community mental health nursing, community learning disabilities nursing, and community children's nursing. The Queen's Nursing Institute website is really helpful. It's got lots of very useful resources and guidelines for community nursing, GP, health visiting, district nursing, mental health, school nursing, learning disability, homeless health, public health, care home nursing, and lots more, and lots relating to education. So do check out the Queen's Nursing Institute website. So you'll see, following my overview, before I talk about some tips to how to become a specialist nurse or advanced nurse practitioner, that we're in this period, this transition period, and advanced level nursing practice is aiming for master's level. I've tried to give you as simple an overview as I can. You'll see that we have some community, public health, primary nurse practitioner roles that have defined proficiencies, and some specialist recorded practitioner roles. Employers have defined some specialist nurse roles, whereas others haven't, and there may be changes in the future. So keep an eye on these 3 key websites: your NHS government websites, the Nursing and Midwifery Council website, and the Royal College of Nursing. So when we look at advanced nursing practice as a level of practice, it reflects the 4 pillars of advanced practice. So master's level programs, advanced nurse practitioner programs or clinical practitioner programs, autonomous healthcare practitioner programs, and e-portfolios that trainee advanced clinical practitioners or nurse practitioners may be working towards, will reflect these 4 pillars: clinical practice, leadership and management, education, and research. And these 4 pillars originally came from Manley in 1997, who presented a preliminary conceptual framework for an advanced practice and consultant role. And the conceptual framework was developed from a 3-year action research study involving the operationalisation of an advanced practitioner consultant role in a nursing development unit. And in the future, I'll probably do a talk on the 4 pillars actually, and how to demonstrate through practical examples, because I'm always asked about that. So other resources you can look at when you're aspiring to these roles: there is an RCN Advanced Nurse Practitioner Forum, and they aim to raise awareness of advanced nursing practice across the UK 4 nations. They support nurses who are already working or aspiring to the role as an advanced level practitioner, nurse practitioner. And the Royal College of Nursing in 2018 wrote Royal College of Nursing Standards for Advanced Nursing Practice, and there's an RCN Clinical Professional Resource. And these standards state to be able to work an advanced level practice, nurses need to meet a number of standards, and advanced practice is defined as a level of practice rather than a type of practice, which might link more to a specialist nurse role, for example. Some example roles: clinical specialist nurse, specialist nurse, nurse specialist, nurse practitioner, advanced nurse practitioner, and as I mentioned earlier, there are many more titles. Advanced clinical practitioner roles are also you can apply for as a nurse, but they will also be open to any allied health professional usually, and there's a range of pay bands, and across fields and settings you'll find these roles. What I would say, usually clinical nurse specialists focus on one particular specialist area. The role is usually tailored to a patient's level of need or one aspect of patient treatment. So example, when I scoped some of these roles, I found a Macmillan cancer clinical nurse specialist to improve the quality of care of cancer patients, and also a diabetes specialist nurse and a heart failure specialist nurse. So you can see they're focusing on a particular specialist area. And supporting these roles will support self-management, enable patients to manage symptoms and deal with their diagnosis, but a vast range of job descriptions relating to roles. When I looked at nurse practitioners, they were more actively involved in, I would say, diagnosis, treatment, and more generalist skills. And advanced nurse practitioners, where we are looking at future regulation, as I talked about, would be more, the roles tended to be more autonomous, managing an episode of care within the scope of advanced nursing practice. And their experience would reflect that, undertaking comprehensive, complex patient assessments, interpreting investigative work, and providing follow-up. But it's interesting to just go out there and look at some of these example roles, because until we have future regulation, there will be differences between those job descriptions. So when you're aligning your training and academic development, and you're aspiring to become a specialist nurse or advanced nurse practitioner, you may be required to complete a post-registration specialist course. It's very specific to the role, and it might be a diabetes or a stroke, multiple sclerosis, substance misuse, or oncology specialist course. It might not have any specialist course linked, and they might train you up in the role and offer the course. So it depends if it's essential requirement or a desirable requirement when you apply for jobs. So do scope those job descriptions and personal specifications. Other jobs may ask for specific qualifications or modules. I saw jobs when I was scoping recently for independent prescribing qualification, or they were requesting a specific module such as history taking, clinical decision making, or advanced clinical assessment module as a standalone module, and others were requesting specific courses. You may be required to complete a master's, so there are many roles, advanced nurse practitioner, already out there that you must have completed a master's at level 7. The Scottish equivalent would be level 11. Others will have training advanced nurse practitioner posts available where you'll be working towards masters or completing an equivalent e-portfolio. Again, it depends on the employer, and in the future it may be defined as only a master's award. So we do need to look out for regulation. And other jobs were requesting research certificates and training, or teaching and learning certificates and qualifications. So 6 ways to support your progression. Increase your insights of what the role entails, and I'll give you some tips on how to do that. Offer to support educators and develop others. Promote evidence-based practice. Evidence of leadership and management. Complete academic courses aligned to the role, and prepare rigorously for your application and interview, as these posts are very competitive, and I will give you lots of tips. So increasing your insights and knowledge of the role. First thing, review job description and the personal specification for the role that you're aspiring to. And it will have desirable and essential requirements for professional experience and academic qualifications. And then you start working towards that goal. Informal visits is a great way to go and talk to specialist nurses or advanced nurse practitioners about what they actually do, and to shadow them. And you can bring your experience of shadowing and your informal visit into your interview, and it shows that you've gained insight into the role. Talking to people in the role, or the lead recruiter, joining the RCN Advanced Nursing Practitioner Forum, and reviewing current Nursing and Midwifery Council, Royal College of Nursing and NHS resources. As I said, this talk is June 2022, but in the future, constantly these professional bodies and union are updating, and it's really important to keep up to date with what's going on, and the key documents, as I mentioned earlier, are on these websites. One of the 4 pillars for advanced practice is education. So offering to educate, support and develop others in your current role. So you could act as a practice supervisor to students, to newly registered nurses, to support workers, trainee nursing associates, and sharing ideas and your resources and experiences with others. You could help to orientate staff to a role, induct new starters or students, teach others, link to your clinical practice development nurses or nurse educators, your line manager. And if you see a gap or a need for some education in the area, then you could produce a poster, do a talk, develop resources and teaching packs, or run patient support groups depending on your role, develop documentation, evidence-based documentation, or act as a link nurse, especially if it's a condition-based specialist nurse. You could start, and you've got an interest in, say, diabetes, you could start linking in wherever you work, be it community setting or hospital-based setting. You could act as a link nurse for that area. So promoting evidence-based practice, again, linking back to the 4 pillars and research. Examples might be running a journal club or joining a journal club, collaborating with or leading a research project, publishing your work, and I'll do a talk in the future with some tips on publications, contributing to local or national policy development, joining professional forums, shared governance groups is going to help promote evidence-based practice, and attending relevant conferences that align to the role that you're aspiring to and sharing what you've learnt. And I have a video, 5 ways to influence nursing practice, that's well evaluated, that really covers some of those areas. Evidence of leadership and management, again linking to the 4 pillars. So supporting your line manager, local leadership team with project work, linking to local and national leadership forums. We've got the RCN Leadership Forum, which is a really good group to join, and networking, collaborating with or leading a quality improvement or service improvement project. And I have a video on quality improvement projects and service improvement projects for nurses that's been well evaluated, again, that might be helpful to you. So next, complete academic courses aligned to the role. As we've talked about already, there's desirable qualifications working towards certain courses versus the essential qualifications, and many of the clinical nurse specialist roles that I reviewed required post-registration specialist courses in that area, advanced clinical assessment modules, teaching courses, or advanced nursing practice masters for advanced level working. But as I mentioned earlier, we need to be really closely keeping an eye on NMC regulation in the future, and with your NHS bodies, government bodies and the Royal College of Nursing as to what regulation will happen in the future. And finally, prepare rigorously for any future applications, personal statements or interviews. I have a helpful book, How to Prepare for Interviews and Develop Your Career, if you're interested, with some example personal statements. And my videos on my YouTube channel, Support and Career Development for Nurses. It's free to subscribe, and lots of tips for preparing for interviews. The references that I've used in my talk are here from Manley 1997 and Leary et al 2017. And if you have any questions, put them in the YouTube questions, or you can DM me on Twitter or on my website or Instagram. So I hope you found the talk helpful today.